Now in this video we will see different important points in cranial cavity for Ospe, spotting and for Viva. Now here you can see this hole is the cranial cavity. It has anterior cranial fossa, middle cranial fossa and posterior cranial fossa. And you will see different bones in the cranial fossas. This one is the frontal bone. This one is the cribriform plate of ethmoid bone. Here this one is the sphenoid bone, which has body of sphenoid bone, lesser wing of sphenoid bone and greater wing of sphenoid bone. Now this bone is the temporal bone, and it is the squamous part of temporal bone, pitous part of temporal bone and mastoid part of temporal bone, and this whole bone is the occipital bone. Then this one is the anterior cranial fossa, middle cranial fossa, posterior cranial fossa. From anterior to posterior we will see different features. This one is the anterior frontal crest. Behind the anterior frontal crest, this foramina is the foramina cecum. Now this projected part is crista galli. This is the cribriform plate of ethmoid bone. Here is the anterior ethmoidal canal, posterior ethmoidal canal, jugum sphenoidale. Then this is the lesser wing of sphenoid bone on each side. These are the anterior clinoid processes, anterior clinoid processes. Then this one is the sulcus chiasmaticus, and here you can see optic canal. This one is the tuberculum celli, and these are the middle clinoid processes. Here is the hypophyseal fossa, and this one is the dorsum celli, and these are the posterior clinoid processes. And as a whole, tuberculum celli, hypophyseal fossa and dorsum celli, they collectively known as sella turcica. Then on lateral area you will see different foramina. Now just below the lesser wing of sphenoid bone, this foramina is the superiorbital fissure. Then behind the superiorbital fissure there are three foramina in a row, and from anterior to posterior you will remember it by rows. First of all, there is foramina rotundum, then there is foramina ovale, then there is foramina spinosum. Then medial to foramina ovale, this foramina is the foramina lacerum, and behind the foramina lacerum, this is the groove for the greater petrosal nerve, this is the groove for the lesser petrosal nerve, and these are the grooves for the anterior and the posterior branches of middle meningeal artery. Here you can see this part is the arcuate eminence, and this is the tegmen tympani. This is the apex of pitous part of temporal bone, where there is location of trigeminal ganglion, so it is called trigeminal impression. Then you can see posterior cranial fossa. Now in this posterior cranial fossa, this broad area is known as clivus, and it is formed by body of sphenoid bone, its dorsum celli part, and by basilar part of occipital bone. Now these are the pitro-occipital fissure. Then this is the superior border of pitous part of temporal bone. This is the internal aquastic meatus. Here you can see internal aquastic meatus. Then this is the jugular foramina. These are the jugular tubercles, foramina magnum, hypoglossal canal, then internal occipital crest, Vermian fossa. These are the condyles which lodges the cerebellum, internal occipital protuberance, and from the internal occipital protuberance there laterally there are two grooves. These are the grooves for the right and left transverse sinuses, and here you can see these are the grooves for the sigmoid sinus. And behind the this internal aquastic meatus, here you will see subarcuate fossa. So it was all about the different features of cranial cavity.